Good morning, everyone. Let me know if you can listen, please.
Yes, we can hear you good, Liana. Thank you for being with us.
Okay, thank you to all of you. Let me know if you can see my presentation.
Yes, we can see it. You went back to the beginning, so it's looking good right now.
Good. So my name is Liana, and I'm working at the National University, Unai Managua, and here we have in the faculty in Esteli. We are in Central America. We made this map because we want to show you that we are in the center of Central America. So most of the borders, if they come from South America or Panama, they have to come through our country. So we are in a, geographically, we are in a good position. Well, as I said before, we are in the north of the country, in the north of Nicaragua. And here at FAREM Esteli, we have a psychological clinic. Actually, now it is called a psychosocial and communitary clinic. From here at the faculty, we have developed a campaign to face COVID-19 pandemic. Who are we? Well, as I said, we are a regional multidisciplinary faculty of Esteli and Unai Managua, and we work as a clinic which is based on the systemic and comprehensive care of the community. This clinic started working in 2000, focusing in a clinical care, a clinical practice space for students and the university community. The idea was to create a community service. It begins in 2003 to continue working as a community. In 2009, we had a diversification. And this diversification create a space to have more groups and different groups that assisted. For example, sport groups, students, teachers, external groups. And in 2018, we had a comprehensive and psychological and community-based model approached. In 2018, in 2018, we changed from a clinical to a psychosocial approach. This made us to create a very broad range. We had more people to work with. Well, this clinic has been working for over 20 years. Since 2018, we have been working with more social groups, with more groups, not just inside the faculty. Now we are working with the schools from surrounding, with the organizations like Minister of Education or Minister of Family. As I said, we have a psychosocial and community approach. What do? Well, we accompany in a professional manner to psychosocial and community management of different persons, of different people, families, communities, to affront community situations that affect especially mental health of people. What we do, we have a team of professionals and students of psychology and social work, and in the university community and the community in general. We work in coordination with governmental and non-governmental institutions. How do we do it? Well, we do it with psychosocial care, promoting training and sensitization, communication, follow-up, and monitoring. As I said, we work with the other organizations, so we work together. In this clinic, we have the mission to guarantee accompaniment processes, psychosocial awareness to members of the university community and social environment. The ambition we have is to be a space of psychosocial care and comprehensive training from multidisciplinary work to ensure the optimal and functional development of human environment. In this picture, you can see our students and teachers. They volunteer at this clinic. Some of them are students from psychology and social work. The way we have done it is developing a campaign to work inside the faculty. At the beginning of the pandemic, we decided to create this campaign because there was a lot of lack of information and there was a lot of fake news and everyone was scared of what was happening. So what we do is develop sessions with the students in order to strengthen their cognitive and emotional and physical skill, to promote self-esteem as well, emotional intelligence. What we had to do here, we wanted to do here was to create group cohesion as well. We also work with the sport, and we also work with activities to develop teamwork, emotional intelligence, not just as individual, as a social group. In the first pictures, you can see all of those are professors, and the second ones were students. We work in the community as well, not just inside the faculty, not just inside of the university. We go more further than the gate. We work with the schools around the faculty, elementary schools and high school. We work with 5 elementary schools and 1 high school, which is one of the biggest one in the city. What do? We work with teenagers, we work with kids, and we have this group therapies that we develop them in order to help them to improve their self-esteem, but also to understand their emotional intelligence, bullying preventions, child protections. We have different topics as prevention of COVID-19. We also work with the families, not just with the students at school. We work with the families. We provide them attentions. We provide them contacts, and we guide them when there is a situation or there are some kids or families under risk. Because what we do is visit families, visit children, and then we have coordinations with the Minister of Family and Minister of Education, the police, and other organizations that can help us to proceed in case we need to. Well, with this campaign and all of the work of this clinic, what we want to do is to develop adaptive and emotional skills, especially during this situation of the new era, the new lifestyles we have due to COVID-19. Well, what do we do it and how do we do it? We had the problem, we had a statistic were going up and many people was dying or getting infected by the virus, and the country, we didn't have a quarantine and we need to have a solution. So the country was working and the university was working as well. So we had to find out the solution. So we worked together. We work with all of the ministers, we work with other universities, because this is a new way of living and we have to continue. How do we have to continue? All together. So we have to make an effort in order to reestablish all of the activities we do as a country, as a community, not in an individual way. Trying to include all of the sectors, all of the people. One example of this is that now, the last 2 weeks, we have the vaccine, and the first people who is getting it for free is people who has been sick, chronic. The one who are still in the hospital, maybe they have cancer. So that is a priority for us. As I said before, working all together. Well, what is the objective of this campaign? To strengthen adaptive capacities of the university community to face the COVID-19 pandemic. And we have focused this in 4 aspects or 4 areas. Mental health, innovation, gender equity, and physical health. We have had different phases of COVID that encourage the intervention and action in Nicaragua. What is the context of COVID-19 in Nicaragua? Well, in March, we had the beginning. There was a lack of information. There was a lot of fear, anxiety, and we had new habits. We had to wear the mask. We have to wash our hands. So it was a difficult process. Then on April, we were suffering a lot of anxiety, fear of physical contact, isolation, and of course, uncertainty. When we had the COVID-19 in the top was on May. It was a lot of grief, hospitalization, fear of interacting or infecting people and being infected. And
It seems they are having some issues, so let's just make sure that they come back on it again. Sorry for the inconvenience. Oh, there you are, Liana. We can see you again.
No. Yo le dije a ella, no lo apagues porque si no se desconecta.
And now we can.
no, ya me conecté con so,
Okay, we can see you, we can hear you.
¿Me escuchan? Can you see me?
Yeah,
Can you
we
hear
can-
me?
and we can hear you, yes.
Sorry, the power went off and so we lost the connection, but now we are back.
Don't worry.
I'm going to share the presentation again. Cindy, can I share the presentation?
Yeah, you can go ahead and open up.
Okay, let me see if I can you see the presentation?
Yeah, I think you might have to skip forward.
Okay, let me know if it was here or,
No, go ahead. One more. One more.
okay, there?
No. Nope.
You already saw this one, right?
Yeah.
Okay, we have been talking about how do we work to face this pandemic. So with the clinic, we have worked inside the faculty and outside the faculty, right? And here we can see some pictures of the activities we have done, not just with elementary school, but also with high school and the families as well. How do we do it? What we want to do is to develop adaptive and emotional skills. We work together. We work with Minister of Education, we work with Minister of Families and the police and other cases if it's necessary. As we have been talking during this morning, we have seen that a lot of violence has increased and some people have suffered more violence inside their homes and or schools. We work with them with these campaigns, not just to prevent the virus, not just to prevent COVID-19, but also to prevent bullying, to prevent violence, to protect child. So we have many goals during this campaign because it's a new way of living and we have to continue. We have to continue all together. So what we are doing is together we are making a big effort to have better life conditions, to change this lifestyle into this new era, to protect ourselves and to protect the people who is surrounding us. This campaign objective is to strengthen adaptive capacities of the university community to face COVID-19 pandemic. And we have set 4 areas to work with. We want to work with mental health, innovation, gender equity, and physical health. Why do we want to work with these 4 areas? Because we have some of the areas people give less importance is mental health. But with the COVID-19, everything's on your mind. You have to control yourself. You have to understand how to control fears. And we have violence has increased, but also economy has been affected. So that's when people has innovated. Actually, a few weeks ago, we had some statistic and says that Nicaragua has the first place in the region in Central America of innovation. Many people got new ways of living during this time because of the companies they were working were closed. So that's why we have these 4 areas. In Nicaragua, COVID-19 had a timeline that started on March 2020. At the beginning, we had no infected people, but we had a lot of lack of information. That affect because there was more anxiety. We had new habits as well. And we had to wear the mask increased the prices, so that was more difficult. Then on April, we have to control our emotion. We have to learn to do that because we were suffering anxiety, fear of physical contact, isolation, uncertainty. We didn't want to go out, but we had to because we were still working. Students were coming here. But then on May, there was the virus increase and we had grief, hospitalization, fear of infecting or being infected. And we had a lot of internal migration. I want to explain a little bit about internal migration, and is that most of our students come from other cities in the north of the country, and they had to go back to their houses, they had to go back town, and some of them moved to countrysides, or some of them went to some family members' farms because they thought they were more protected over there instead of being in the city. In that moment, we wanted to have virtual classes, but most of our students were in places where they had no connections. So we had to look for another option to continue with their studies. In June, we started having more social problems because we had more discrimination against people who was infected, and we didn't know how to treat them. There was more family arguments. Families used to work the whole day and meet at night, and now they were spending more time together, and there was a lot of frustration. We had more domestic violence, and we had especially violence against women and children. So we need to act, we need to do something, and that's when we start with this campaign, because the idea, and then after June, we have to reevaluate, we have to reorganize the system, reorganize what we were doing. So we're promoting a lot of reflections, especially to get used to the virus, to get used to the new protocols, the new ways of taking care of yourself, to change your lifestyle. So we wanted to intervene, but we did it through a joint visions. That's why we decided to involve and contact Minister of Education, Minister of Health, Minister of Family, and some other NGOs as INSPOP or FUNARTE. Both of them work with children and families, and they work directly in the communities. So we have to look for the contacts to go directly to the community who were needing our support. We were working in coordination to develop a collaborative work in order to strengthen and share strategies. We developed many activities that we are still doing now. In March 2020, we are planning the next activities we're going to have the rest of the semester and the rest of the year. But we have developed informative fairs. We create emotional and digital backpacks. We call them backpacks because they have a lot of tips how to understand or how to succeed during this time during the pandemic. And we distribute them in a digital form and physical as well. So we had some, it's like a flyer, I will show you some. And the digital one, we distributed through the website of the faculty and social media. So we could contact a lot of people and we could help them in different places, not just in our city, not just in our country as well, because we were sharing them with other people abroad also. We had art festivals, public art, especially like mural, giving informations, and we have different sessions of self-care, because as you saw the pictures, we were working with the students and we were working with teachers. We need to know how to take care of ourselves, but also how to take care of the others. And we also had spread information because there was a lot of lack of information. So we did it through different spots, flyers, posters, brochure, because what we wanted was to avoid fake news, because was many people distributing fake news, and that was creating chaos in the city or in the country. This is one of the backpacks. We did 54 backpacks, and this is one of them. And it gives you tips. For example, look for support in the others, in other people. Limit the access of social media. Talk to your family, friends, neighbors, and look for reliable and objective information. We had some other examples here that give you some tips as well to how to do it. And we had some steps, and as we can see, it's as a cycle that can help everyone, because we were from the beginning, and now according to how the news and how the virus was acting in the country, that was the information we were sending them. For example, the backpack number 15 says in the number 1, it says we have to have pertinent sense, and we are Nicaraguan, and we work to develop our country and develop ourselves, and we have to include people in social and intercultural inclusion. We are a group, we are a collective, and there are spaces that the participation for all of us. We have to strengthen differences. We have to start learning to live in a proactive way. We are responsible of our relations, and we are responsible to be part of, because we have to value ethic and we have to work together. Well, we have to create new protocols, we have to create new systems, and we had this kind of information all around the faculty, inside and outside. So people from the communities and the neighborhood surrounded, they could see as well. This says, I take care of myself, we take care of ourselves, wear the mask, keep distancing. We had this information, as I said, all around, and we had to create this new way of keep your hand clean. So we have installed all of these things all around the classrooms, and because we only had them in the bathroom, but now we have it in front of the classroom, so students can take a time, wash their hand, and go back to their class. We have, before the semester, before receiving our students, we create with the volunteers more information, but we wanted to have information that could encourage them to continue and not to be afraid. As you can see here, they are coming in. Before they have to clean their shoes, they have they sprayed alcohol, they measure the temperature, but they can find in the different areas this message where encourage them to take care of themselves, but also of their mental health. With gender equity, we had different talks, Congress, and women's fair. And as you can see in the pictures, we have been developing some campaigns with the Minister of Health, and they come inside the faculty and they were applying the vaccination for influenza. So that was the idea, to prevent the flu and not to get confused with the symptoms and to avoid getting sick. And that was inside the school, and it was for free. We also work with the Red Cross because we have different campaigns of blood donation and others. We were inside the university, we were in the schools, but we were in the community, working with kids, working with elderly, and as you can see, taking precautions, wearing the mask, but not being isolated. Inside the university, we had some activities to promote physical health, and we had some walks, dancing fest, emotional aerobics. So students were coming through offices and motivating people to stand up out of your desk, out of your computer, and do emotional aerobics. And that helped us to create relief, because you can see you could continue having your life and helping others, but not just thinking on the virus, not just being attached to the COVID-19. You can see some of the picture of the walks. We have some fields where it's possible to do the activities, do the walks, and taking distances, maybe not wearing the mask. I want to mention that some of these activities were preventing activities that start before the virus came to the country, before the virus started attacking us in the highest point, because we had the preventing activities. We wanted to have more information. So that's why people from Ministry of Health came to explain what was the virus, how did it act, and what we should do. So that was before, so we were not wearing masks, we were sitting all together, but after that we have to take new protocols, we had to take new strategies, as I mentioned before. We still work inside and outside. You can see this is a tournament of chess. Our students come and coach elementary school kids and teach them how to play chess, how to develop their emotional intelligence, especially taking care of their mental health. COVID-19 gave us different things and told us that contact was prohibited. But we know that relationship is necessary. So that's why we create the backpack, emotional backpacks. And our priority were attention. With the backpacks was a way to bring information to people through social network. Was a technique of awareness and reflection due to the pandemic. It was a work tool for care. It also was a means of analyzing the situation from all contexts as it is evolving. It helped us to understand and analyze the stages that the population lived personally and socially. This made us think about personal attention to people emotionally affected, to prepare and sanitize public spaces regularly. Also, it makes us to modify services time and teams avoiding crowds, attention directed to family in a comprehensive way. It also helps us to understand that the community needs our care and we could take care of them in different ways. Well, as Ventura de Sousa Santos says, the virus is a pedagogue who is trying to tell us something. The problem is knowing if we are going to listen to it and understand what it's telling us. I want to show you a video of made by our students, the volunteer of the clinic. By the way, they are connected in a classroom here. They have 3 of our colleagues are translating for them all of this session, all of this forum. And I want to show you, Cindy, please.
Yeah, I'm gonna go ahead and change the presenter. Whoops. Okay, gonna go ahead and play it. You're looking at the video, right?
Yes.
Okay.
Hi, my name is Margie. Mental balance. It was useful to learn to trust on my skin, assuming difficulties as an opportunity to learn more. My name is Scarlett Garcia. Resilient. I have need to flexibly handle through many situations.
My name is Leandro Paramo. Empathy is helping to make a pause and reflect on that human and social part, while in small details such as being together at home and sharing moments as family.
I want yourself to express to myself and to learn to identify related information.
Hello, my name is Munir. It was easier for me to keep calm and not carried away by social context.
Well, as you could see, we have a little bit of what information about what the emotional backpacks wanted to express, how the emotional backpacks help our students. It was very useful for students, for their family members, for their friends, because they could share through WhatsApp, through different social medias, this information. There were more people who were asking for them, and they were asking for, okay, I only have 4, could you send me the 5th? And maybe we only had 4 because we were in the process, until the moment we had to build 54 backpacks. So this is part of the experience we have had with the clinic, with the university, and with the other organization we have been working together. We continue, we're still working in this project, in this campaign. We applied for another project and we won it actually. So now we have a little bit more of support to develop more activities and maybe to reach more schools and more people than we have done it before. So thank you so much for your attention. Thank you so much for the opportunity.
Thank you, Liana. I don't know if people want to go ahead and make a couple of questions before we jump in on the next one.
Okay, for questions or comments, I also have here my colleagues, Tanya and my colleague Lineke. No, they are the coordinators of the clinic. So Tanya is psychologist and Lineke is social worker. So together they work with this big project.
We want to thank you for an excellent presentation, Liana and the colleagues from Nicaragua. And we would like to know how do you make the emotional backpack available to students on campus?
Las mochilas emocionales fueron publicadas en las páginas que tiene la UNAM a nivel nacional. Hubo una gran apertura desde la UNAM en Managua para que las mochilas fueran publicadas desde la página principal que tiene la facultad, y por otro lado fueron utilizadas también en los espacios que se abrían en las escuelas por los estudiantes que las visitaban. En este caso también nosotras asesorábamos esas visitas de manera que la misma información que había en las mochilas emocionales y las técnicas y las estrategias también que estaban recomendadas desde ahí fueran aplicadas en las escuelas.
Well, the emotional backpacks were available on students through the main website of UNAM Managua, and also in the website of the faculty, FARMSTLI, and the social media. Those were available so they could just download it and see it, and they could share it as well with their contacts. And also we had it online, but also we had it printed. So those were distributed in schools with the strategy, how to talk with the students, how to discuss, how to apply it, how to use it. And we were trying to control it in this because we had some visits. We were visiting some schools.
Excellent, excellent. And I want to remind everybody that the handouts are available. You see it on the square on your screen, and there's copy also of the emotional backpack. Gracias. Excelente presentación y muy agradecidas que están con nosotros.
Now we are in a part of the project that we are translating the backpacks into English, because many people we have contact with, the university has worked with, would like to have them. So when they are ready, we can share them as well with you.
Thank you, Liana. I think some of our folks here will definitely want you to share these links or materials whenever they're ready in English, because we received a question regarding the mochilas or the backpack, and they're asking if the information that you were able to share was shared out of smaller towns, or if it was just around your area.
En este caso, cuando me refiero a la página principal de la UNAM, como eran desde la UNAM Managua para todas sus facultades, entonces los estudiantes pues la recibían donde pudieran estar, más si las clases estaban virtualizadas, entonces eso permitía también que ellos tuvieran acceso a la página con más facilidad y la pudieran leer y transmitir eso a otras personas que estuvieran en su comunidad. Por otro lado, muchos de nuestros estudiantes en ese entonces, cuando la pandemia estaba en su punto más crítico, se trasladaron de la ciudad al campo y pues a través de sus celulares y de las plataformas que habían habilitadas para recibir clases, pues también podían recibir información acerca de las mochilas emocionales.
Well, the backpacks were available in the main website of UNAM Managua. In UNAM Managua, we have 44,000 students, and they could spread it out all over the country, and they had the opportunity to have it. Most of our students went back to their towns, to those small towns or countrysides, so they could have access to these backpacks through their cell phones or different platforms that were available to receive their classes. so they could access to the information and share it with their friends or family. So that was the way they could, these backpacks were distributed as well.
Thank you all for that answer. I just also share a link that was available from the CSUCA, where you have the information in Spanish, if anyone wants to use it in Spanish as well. I think that could also help. And then we got another question regarding the backpacks, and it's regarding feedback. Did the families gave you any feedback on how they use them?
Bueno, voy a comentar un poquito sobre mi experiencia porque en ese entonces yo trabajaba en el Ministerio de Educación y cuando yo tuve la oportunidad de compartir estas mochilas emocionales con los consejeros del ministerio y practicar algunas de las técnicas en mi trabajo en el colegio donde yo estudiaba. Entonces, para nosotros las mochilas emocionales significaron también mostrar una alternativa para los estudiantes. Y yo sentí desde mi experiencia docente de escuela que transmitía a los estudiantes y ellos me podían decir a mí también todo lo que sentían. Mis compañeros también me expresaban cómo los niños y las niñas y adolescentes percibían el proceso de la pandemia y hablaban ellos que incluso los adultos se separaban de ellos porque les decían que ellos no tenían riesgo, entonces aléjate de mí porque me puedes transmitir el virus, o vos vas a la escuela. Las escuelas estaban divididas en grupos pequeños o bien recibían clases virtuales. Entonces, sí tuvimos todas las respuestas de los niños y de los adolescentes, las emocionales y las que tienen que ver con sus sentimientos, y cómo ellos percibían el mensaje de la gente adulta cuando decían que el vecino había muerto de COVID, que habían ido a enterrar a alguien rápidamente, porque eso les generaba también estrés y les generaba un poco de incertidumbre. Y ellos también expresaban la forma en que el miedo de ellos les limitaba la relación, por ejemplo, con sus padres o con sus abuelos. Y de ahí fue que también identificamos cuántos muchachos y muchachas se iban al campo, donde sus tías, sus tíos o abuelos, para estar aislados y para no contagiar, para no ser una vía de contagio. Eso fue por una parte lo que se vivió. Por otro lado, atender el duelo, que era otra forma pues en la que se expresaba la crisis. Y hablar con familias que enfrentaban el duelo también era difícil, sobre todo para los niños que habían perdido su papá, su mamá, su abuelito, su abuelita, y que expresaban también cómo eso les hacía sentimientos de impotencia, la idea de pensar que pude haber sido yo el que lo contagié. Atender todo eso desde la clínica, pues era algo fundamental para nosotros.
Well, from her experience, she was during the highest point of the pandemic, she was working for the Minister of Education, so she was working on high school system, and she could share the backpacks with her colleagues and the students. And also at the same time, she could see how effective they were, because she received feedback from the colleagues and the students. They said, her colleague says, how students were really mature and they could manage their feelings and emotion, how they understood the virus and the behavior of it, because it was difficult for them because as they were teenagers, so they suffered discriminations because they were not infected by this virus, and they could have it and infect others. So they had feelings of guilt, like maybe their grandparents were infected and they were like afraid of being them if they were the one who infected them. So all of these backpacks help them to manage their emotion to manage the situation and control them, to identify the information they were receiving as well. It was a good alternative for students to transmit and receive information as well. The result was how you could survive, as we can say that word, to this situation, because there was a lot of pressure listening on the news that there were expressed funerals, or maybe their neighbors was dead, or someone really close to them. That's why many of our students went to their countryside, went to their hometown, and that limit their relationships with their families because they were afraid of infecting. So these backpacks and these tips help them to manage all of this situation and control the situation that was happening surrounding them.
También desde la clínica se hizo acompañamiento familiar desde la parte comunitaria y también se hizo atención a escuelas. A cada escuela también se podía llevar como un tips o una mochila para poder mostrar a los niños cómo debían cuidarse emocionalmente.
Also, there was a accompaniment to the schools, community school and the communities. We were not just here or just with the students. We went to the communities and we shared with them the backpacks. And it was not just like handouts, just to giving them. It was like group work because it was a community work.
Excellent. Thank you for your answers. We will continue with more questions at the end of the presentation. We would like to thank our colleagues from the National Autonomous University of Nicaragua, Esteli, for the wonderful presentation and those wonderful resources that they have shared with us. We have found that even more so than sharing information, sharing resources and practical advice that people can use is the more helpful. So thank you for that. Now we will go on to work on the pre-questions for our next presentation that will be provided by Dr. Luz Lopez.